Western North Carolina is seeing an increase in respiratory illnesses. A local health network is making temporary changes to reduce that spread. News 13's Ryan Stockett explains.
We are limiting it now. No one under the age of 18 can come and visit at this time, just really to keep them safe as well as our patients.
Restrictions and protocols are in place at Advent Health to help reduce the spread of respiratory illness. They saw a 40% increase in the number of patients testing positive. Victoria Dunkel with Advent Health says most of those cases were influenza A. Mission Health has no restrictions yet, but they tell us they're keeping an eye on things. Matt Reister, a medical director with Mission Health, tells us that right now they're also seeing a large spike in influenza, predominantly A, and that it's affecting the entire region of Western North Carolina.
It's so variable year to year, and this just appears to be the strain that's hitting the hardest at this point in time.
Reister is reminding people that it's not too late to get your flu shot, and he says that prevention is key, especially for the younger, elderly, or populations at risk, like people with asthma or other chronic conditions.
If you do get the flu, it's really important to stay very well hydrated. You can take Tylenol and ibuprofen for your symptoms to kind of decrease the fevers and decrease your fluid losses. And then it's very important to try to stop the spread.
Dunkel says the best way to stop the spread is by doing simple things like washing your hands.
Making sure that if you have symptoms, you are not going around other people. Or if you're around people who are showing symptoms, that you politely step away and avoid catching those germs.
At Advent Health, not only are visitors under the age of 18 not permitted right now, but any visitors with symptoms of illness are encouraged to postpone their visit until they are symptom-free.
We're asking people who are coming in for appointments, patients who might be ill, to make sure they let our team members know when they check in that they have symptoms of respiratory illness, and they may be asked to don a mask.
And the visitors for patients on respiratory illness protocols are required to wear a mask. Dunkel says they'll continue to monitor respiratory illness rates in the region and return to their regular visitor policy once rates of those illnesses return to normal levels. Ryan Stockett, News 13.